So when initially going into my baby's room to do her assessment, I would make sure to hand hygiene, don gloves, especially when touching her, check ID of hers to her mom's, and then also make sure she's in a very warm environment. So just the initial posture of the baby, just looking at her, everything seems symmetric in look and movement. The baby is flexing at the elbows, hips, knees. Now we would take the temperature of the baby using a thermometer. The normal limits would be in between 36.5 to 37.5 degrees Celsius. Then we would go ahead and do measurements. So we would measure the head. The normal limits would be 32 to 37, and you would measure from here to here. We would measure the chest from the top of from the nipple line around. That should be between 30 to 35 centimeters. We would do the length from the head to the toes, making sure she's fully extended, and that would be between 48 to 52 centimeters. And then we would weigh the baby, making sure she's still warm, zeroing out the scale if we put extra things on there. And the normal would be 2,500 grams to 4,000 grams. So the overall appearance of the baby, the skin looks soft and smooth when you're touching it. The color is consistent with the genetic background. The skin turgor is good, it recoils quickly. There's no signs of jaundice, especially on the bony prominences. There's the nuva on the skin, but that is normal. So the umbilical cord, so it looks like it has 2 arteries, 1 vein, starting to dry out. There's no abnormal discharge or anything like that, so that looks like within normal limits. For the head, the sutures and fontanelles are soft, palpable, firm, so that's all within normal limits. The hair is fine and silky. There's no lesions or protruding, so that's all within normal limits. So just looking at the face, it's symmetric, especially when crying, so that's all good. Her eyes, so I would check for the pupil reflex by just shining a light in both eyes, and her pupil reflex is good. We would look at the color, so this baby has blue colored eyes. She could also have gray, which would be within normal limits. Most babies have that. There's no jaundice on the scleria or anything, so that's also good. Her ears, so her ears look symmetric with the eyes. When I clap on one side, she gets startled and then responds to that clap, so her hearing is good. So her pinea is soft and round and firm, so that's good. Sorry, it's not soft, it's just round and firm, and then it bounces back quickly. And then it looks like there's no skin tags in the ear, so that's all within normal limits. So the nose looks symmetric to the rest of the body. When I occlude one nair, and then the other tells me that her nairs are palpable, are patent, sorry. So that's all within normal limits. So her mouth. So when I stroke one side of her cheek, she tries to root to that side, so that's good. Her hard and soft palate, when I insert my finger into her mouth, are closed, so that's all good. Her mucous membranes are pink. Her uvula is centered when she cries, and then when I put my finger in, I feel no false teeth. She has a good sucking reflex, and then everything seems within normal limits in the mouth. When I assess her shoulder and neck, just making sure for no clavicle break, that all seems within normal limits. Her trachea is within the midline. There's no abnormalities with the neck or the shoulders. Her chest, when I look at her chest, it's round, circular. Her abdomen is a little slightly distended, which is normal. When I listen to her heart, I'm going to listen for 1 full minute, and then it should be between 120 to 160 beats per minute. Which it is between 120 to 160, so that's within normal limits. When listening to her lungs and her when listening to her breath, respiration sounds, you also count for a full minute, and that should be between 30 to 60 beats per minute. So then I'm gonna listen to her lung sounds. Flip her over and then listen to her backside. Okay. I could have laid her on the bed as well to do that so I get a good sound. Also, I'm going to listen to her bowels. Listen to each quadrant. So each of her bowel sounds are active, and then when I palpate, I can feel her liver, the tip of her spleen, and you can also feel the kidney, but you can also not in some babies. It just depends. If I were to need to check the blood pressure, it should be between 60 to 80 systolic and 40 to 50 diastolic, which I don't have to check for this baby. So then moving on to her arms, there's no extra bony prominences or jaundice on the prominences. When I do the palmar grasp, it's good. She curls her fingers around mine, and then she has 5 fingers on each hand. When I do the brachial pulse, same time, that's good. And then also the femoral pulse, which is good as well. So checking the genitals of a male, your urinary meatus should be midline, and then your scrotum and testes should be palpable for the right and left. Females, your labium majora should cover the labium minora and the clitoris. This baby has no discharge, but it wouldn't be uncommon if the baby had light discharge. So when checking the anus, if you stroke one side of each, it should stimulate the anus to kind of like palpate, which this does, so that's normal. For the hips, when I bring the hips together, they're midline. When I do the Barlow's test, it's normal. There's no signs and symptoms of clicking or dislocation. Do the other test also, which is hard on this one. When looking at the feet of this baby, there's no clubbing present. She has 5 toes on each. When I do the Babinski test, her toes curl, toes go up and out, so that's normal when I go up in there. And then the plantar test, her toes do curl around mine when I do that as well. Flipping the baby over, so the back, the scapula, and everything is midline. It looks like I can see the spine is midline. There's no Mongolian spots, however, that would not be uncommon, especially in darker ones. I can palpate the vertebrae and also see them. There is the dimple present and it's closed, so that's normal. And then the gluteal folds are symmetric, also normal as well. So we're going to flip her back over. So the legs, she again has 5 toes. Everything looks normal, no bony prominences, anything, jaundice on the bony, or her joints and everything are good, so that's good. So overall, the baby has good mobility. For her reflexes, we're going to lift her up, just making sure that her head doesn't go too far back to hurt her. Then we're just going to slightly drop her, and then she should have a startle reflex, which is normal, that's good. The scarf test, wrap her arms completely around, depending on the gestational age, but for this baby, she's good for her age. Her heel should be able to come up to her ear, which it does, so that is good. When turning the baby's head to one side, the rest of that body, the side of that body follows, so that's normal. And just her neck mobility in general is good. When I pick up the baby and stand her up, she should kind of like mimic a walking motion, which she does, so that's normal. And then I can't really do the square window test on this baby, but if you hold the hand down to the forearm, that would be normal. And then just another skin assessment before we wrap up. No abnormalities. If you were to, milia, Magnolian spots, stork bite, episteme pearls, those are all normal findings if you find them in these babies. So I would document that this baby has everything within normal limits.